I would like it. Okay, today, this morning, I have Miss Terell, and we will continue, to follow this here residency. Today, I have a couple questions, so I'm gonna turn my camera, and here she is. We are in the room. That's like a typical ICU room. We just got new pumps. Um, so there is Terrell, and I'll probably go closer. So my first question, Terrell, would be why ICU? Why not med-surg? Why not oncology? Why not emergency? Why ICU?
Well, ICU because before I became a nurse, I was working in ICU as a unit secretary and telemonitor tech. And I kind of like the settings in ICU because the patients are you already established the patients, but it's not like ER that patient comes and goes and you don't know what you're getting. ICU, and I like the challenge in critical care. I like to like dig and research what's going on, and all that kind of stuff. Like it's more challenging to work in ICU and work in a critical care than med-surg. For me, it's kind of different. It's a slow pace. It's kind of boring, and I will lose my interest in med-surg. That's just me.
Okay, guys, she just said med surge is boring. Okay, med surge, then you have what? Six patients, nine patients. It depends what state you at. Um, I don't think it's boring. I think it's very busy, and it's just you don't have time to think. You just going like this. But
Yeah, but when it comes to like critical care, like you have a challenging patient, a very sick patient, and I like challenge. So when it comes to comparison of mid-surge and critical care, mid-surge is like more stable patients than
yeah,
critical care. Critical care is like you have to deal with a bunch of machines and all that kind of stuff. You have to go,
I was showing
you know,
new pumps.
uh, a lot of different meds, like critical care meds.
Yeah.
And like I said, I like challenge and all that kind of stuff. It stimulates my brain. I like it when my brain is being stimulated. So,
Hmm.
yeah.
Okay. Well, s- talking about challenge, what it was yesterday, right? So yesterday we had a patient who came to ICU around 3 p.m. from med-surg, and the patient was quite stable, but unfortunately, the condition of this patient, the patient deteriorated slowly but surely. So it was first death, I would say, for your residency. And I just wanna know how you feel. What were your thoughts and um, the thought process?
Um, with her diagnosis, it's kind of like I was already like thinking ahead of time, like because patient with her diagnosis is kind of like uh, she is has a really low prognosis. So um, I don't know really, to be honest. It's like almost like an expected outcome. It's not like a sudden death, like you know something like that it will surprise you. It's not really surprising with her diagnosis, kid,
Mm-hmm.
because there's much you can do about it. Like
Yeah.
um, you've already done everything. You know the nursing staff already did. We did our part. The doctor did their part. But really, I mean, for me, it's not like it's a shock a little bit. I was shocked a little bit, but I was not really surprised because, like I said, it's kind of like an expected outcome with the kind of diagnosis that she has no, you know,
Mm-hmm.
she really have a low prognosis to survive without any, what do you call that, interventions, like major interventions.
Yeah. Well, honestly, like for me, I was just like, oh, we got a good case, so Terrell can get, training,
Yeah, it was a
working the
good case.
yeah,
Yeah.
working this intubated patient. But unfortunately, then we came back. Um, the patient expired or passed away at 6:45 p.m. So when we got here, that was a different, learning experience. Um, to It was kind of challenge to deal with this family, and family was nice. So yeah, I know it's not like you being a brand new nurse and you've seen deaths before, but it's just like the feeling about you were taking care of this patient. She was alert and oriented. She was responding. She was here, and it was less than 24 hours, and she's not here anymore. So that's why I wanted to know, like, your feelings. Um, and then it was like less than an hour, and we got another patient. So you have to move it. So what is your how you protect yourself, how you protect your mentality, because it's pretty strong, like losing the patient.
Yeah, I think working in a hospital, like in critical care, even though I was not working as a nurse, I kind of trained myself how to be prepared and all that kind of stuff. Before when my first death, it was kind of shocking for me. It's kind of hard to handle, but seeing a lot of death and seeing a lot of cases and uh, different diagnoses, it's kind of like, okay, well, it's you know you kind of know what's coming, so
What are
you
you
know.
doing? What is your protection? Because people think that we nurses, we just we
I don't know. I know what you mean, but honestly, I don't know. I think
you just move on, or you do anything like uh, taking a minute for yourself, saying something to yourself.
in this case, no, I don't have any. I didn't have to protect myself in this case because, like I said, I was already prepared and I was already. If you are not prepared to yourself, then that will be a shocking. Then you have to like, reset yourself, your mentality, and then have to, accept, not to be denial. But and in this case, I don't know. I'm already like aware that's what's
Mm.
gonna happen, and so I didn't have to protect myself. I mean, unfortunately, like I'm not sure. Maybe because I'm used to it now. I'm not sure. Like it depends to case basis.
Yeah,
So
I think.
if it
Mhm.
is like a sudden death, like for example, like someone that died unexpectedly, that's probably when I have to be really shocked. Like, but this patient is really different case.
Different case.
Yeah.
I think we didn't develop too much like strings attachment either, because it was just one shift.
Yeah, that's true.
Usually it happens, then you take care of people at least like two shifts, and then it happens
I
that
agree.
difficult, but it was just one shift. So
I agree to that
we
one.
were more busy, task oriented, to get stuff done, to do something to get her well, and we and she was like lethargic, sleepy, so we were trying to get stuff done, and we were trying not to bother her. Yeah, so, all right. Just one more question, and when we will continue. Um, so, I was hoping that you would tell me to about like using your passion for dancing. You will kind of use it to distract yourself from your work, but you didn't mention it.
Time is time, but I honestly, my dancing is my stress reliever.
Okay.
Working in the healthcare, it's a very stressful job. So if you don't have any hobbies, it's not. Uh, for me, it's not good. You have to have a diversion and outlet.
Mm-hmm.
Any kind of hobby that you enjoy yourself, like pickleball, whatever hobbies, running, dancing, cycling, hiking, anything you have to have, because otherwise you're just gonna be consumed with all the stress in your life, working in the healthcare, which is eventually your body is gonna slowly will give up eventually because of all of the stress. So you have to have like a different mentality and outside the settings, like working in the healthcare is a different settings. Your brain is set up to that, the how to think critically, how to deal with stress related at work, and to adjust yourself. And then if you go home and you don't have any outlet or diversion, then that setting is still stuck in your head, which is very important that you have a habits to kind of like change,
Reverse change,
the
reverse, and
settings,
yeah.
which is because that's a healthy life.
Mm-hmm.
Because being in that stress all the time, it's not good. I've been there, and I know what's the effect in our body.
Okay. All right. Well, thank you, Terrell. Thank you for giving me that interview. And so we got another patient. This I think he's pretty stable. So everything is going well. You're doing fantastic. I appreciate you
Thank
so
you. I
much.
appreciate you too.
Yeah, because it's. I think it's a like a not a challenge, but I think it's like we learning different roles. Like you come into ICU, I'm learning how to be a preceptor and not to be just like, hey, don't do this, don't do that.
Yeah.
Okay, that So that's very. I think it's very rewarding. So I'm enjoying working with you. I always enjoyed working with you, but it's just different role right now.
Yeah. And as every day is a different challenge.
Yeah, it is. Every day is a different challenge. All right. Thank you, Terrell.
You're welcome.
Okay. Thank you, guys. That was my interview with Terrell, number 2. And that was a live stream. And I'll make a video so you guys can just watch it if you have any questions for Terrell, because that's very interesting path what she was going through to get there where she is right now. You write your questions and I'll pass them on and we will talk about whatever you want to know, right?
Correct.
Okay. All right, guys. Thank you so much and have a good day. Bye.